This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. We appreciate you listening in to this episode. Just a reminder, we have several episodes on a wide array of topics available through the device by which you listen to podcasts regularly, as well as on our website at wakehealth.edu/podcast. We are also providing a lot of information and updates related to COVID-19 as well. General information about COVID-19 can be found at wakehealth.edu/coronavirus. There you'll see a list of several podcasts related to various aspects of working through COVID, be it pediatricians, information, stress management, anxiety, resolution, and whatnot. So those resources are available for you all, and hope that you take a listen. Now today, I'm very excited because I have two guests today. Most of the time I have just one guest, so I have double the fun today lined up with two really, really awesome individuals that have been a part of the Wake Forest Baptist Health System for a while and have poured a lot of their time and energy and passion into Wake Forest Baptist Health and making it the best place it can be. Those two people are Dr. Alisa Starbuck, who's the president of Brenner Children's, and Lisa Marshall, who's the vice president and chief philanthropy officer. And they are joining us today for a very cool reason. We are celebrating the first birthday of our new neonatal intensive care unit at Brenner Children's and the birth center at Wake Forest Baptist Health. So it's hard to believe it's been 1 year since those have opened, and these two guests are going to talk about just the impact that these new facilities have made in countless families' lives. But before we get into that, I just want to have these two individuals tell a little bit about themselves. So we'll start with Dr. Starbuck. If you wouldn't mind, Dr. Starbuck, first of all, welcome. Very glad to have you today.
Thank you, Justin. It's a delight to be here. Thanks for having me.
If you wanted to just take a moment and tell a little bit about yourself to the listeners, and also a little bit about Brenner Children's Hospital and how it relates to Wake Forest Baptist Health and how the NICU and the birth center all connect to Brenner Children's, if you don't mind.
Yeah, be my pleasure to do that. My professional background, I am a nurse and a nurse practitioner. I began my career here at Wake Forest Baptist Health, Brenner Children's. Was one of the first inaugural nurses of the Children's Hospital about 30 years ago. Spent most of my time in the neonatal ICU, later moved on to some administrative roles and helped with the trauma center in terms of getting us designated as a level 1 trauma center. We were the first one in the state, which is really a high honor for any children's hospital, but that says that we give the highest level of trauma care quality to children and have a lot of infrastructure there. My role today, I have the privilege of being, the leader, and I have a wonderful team of both the Children's Hospital and the Birth Center. So a little bit about Brenner. It has been with us for quite some time in the community for over, 30 years. When I stop to think about it, it's quite phenomenal, and I'm sometimes taken for granted as one of the greatest hidden pearls we have, probably. We see over 160,000 children in our outpatient visits in our clinics, over 33,000 in our pediatric emergency room every year.
Every year, wow.
Every year, and that's really more patients sometimes than are seen in just local emergency rooms. So that's a lot of kids, and that's a lot of special care for kids. And the value of that is everything is geared toward children. It's not simply providers, but it's every piece of that child and that family's experience from the time they enter the door. And I think that's what helps us give the best experience coupled with the cutting edge technology of an academic medical center. So those two
Mm-hmm.
together, you just don't get any better than that for kids.
Mm-hmm.
So we have, over 450 physicians, nurses, therapists, and staff who really
Wow.
are just dedicated to kids.
Mm-hmm.
And that's what they do because that's what they love.
Yeah.
And it really makes a difference. And if you've never had the experience of a child, in a completely children's hospital experience or a children's emergency department, it's really unlike that of anything else, because people really, that's the heart and soul of folks.
Yeah, I agree. No one necessarily wants to go through the process of having their kids stay at a children's hospital, but I can speak from personal experience. My youngest, when he was teeny tiny, he was less than a month old, and he had to spend a few days there, and it was just the care, the clinical care, but also the compassionate care was just was so extraordinary. I mean, you could tell the nurses and the doctors, they just really love kids, and they want to be there and help kids get better. So I can personally attest to that for sure.
Yeah, thank you. It's the dedication to the child and the family, because without the family's involvement and partnering with them, that really is the whole experience. So we don't separate the family from the child.
Mm-hmm.
It is all one.
Yeah. Well, that's a kind of a great overview of Brenner Children's, and Lisa, I want to bring you in real quick. Some people may not know that a philanthropy department even exists within a healthcare system. So you want to enlighten us on what you do and what the Office of Philanthropy does, and specifically, kind of related to a project such as the NICU, and how you help bring the vision into a reality.
Absolutely. Happy to talk about it, Justin, and thanks for having me here today. I have had the good fortune of being with Wake Forest Baptist Health for 9 years now, and have spent the last several years as the Chief Philanthropy Officer. And I think one of the things that's really important to recognize is all of the missions of an academic medical center.
Mm-hmm.
And it really defines why philanthropy is so important. Within our system, we not only provide clinical care to the communities that we serve, but through our School of Medicine, we also teach and train the next generation of healthcare providers. And we conduct very significant medical research, which changes the course of healthcare as we go into the future. And I can say that in my own experience, I had a child who at the age of 12 was in need of the care of an academic medical center. And I felt incredibly blessed to have those services available to me. And I think when I came to Winston-Salem 9 years ago, one of the things that struck me immediately was that the community didn't necessarily always appreciate the uniqueness of having medical facility of the nature of Brenner Children's Hospital in its midst. And it is so special to have that kind of care available. And so in the Office of Philanthropy, our role is to ensure that all of the missions that we have, the clinical care mission, the research mission, the education mission, can be met for both adults and children. We think it's highly critical to the community. And fortunately, we have the opportunity to work with some really terrific folks, help them understand what it is that's being accomplished every day in all three of those areas, and really spread the word about the impact of Brenner Children's Hospital and what it brings.
Kind of relating that specifically to the NICU, and as we embark upon the 1-year birthday anniversary celebration of the NICU, if you wouldn't mind just talking a little bit about, the role of philanthropy as it relates to the NICU and how you all were involved in this project specifically.
There's nothing more rewarding than working on something that's very tangible and that we have the opportunity to engage people not only so that they understand the importance of it, but that they actually have the opportunity to see the transformation that takes place. And this was certainly one of those projects. So we went to the community early on and gave them an overview of what it was that we were trying to accomplish with the renovation of our NICU. And a big part of that is helping people understand why it's so important. It's easy to say, well, there's NICU there. What else would you need? But the fact is that our NICU really needed to be renovated so that it could be brought up to the highest technology, the best capabilities, and the best environment for both the babies and their families. And that was really important to us because we knew from research, from the education that we do, that environment has a tremendous impact on the overall care and the overall recovery of these patients. It was something that we could all get very passionately behind. And what we saw very quickly was that the community did as well. There was great outpouring of interest. We did lots and lots of tours of what the space was and what the space might be as we go forward. And really, the partnership with our doctors, our nurses, everybody in the institution, the leadership team was really wonderful because everybody felt very passionately about this project. We were also incredibly lucky because early on in the effort, we were able to connect with Karen Sisel, and she became very passionate about the project as well. And really became a leader in our efforts to fundraise for this initiative. She wanted to see it happen, and she was instrumental in making it happen by making a $5 million gift. Wow. And she did this in her and her husband's name, so it is the Karen and Dale Sisel NICU. And though Dale has passed on and was not part of the actual activity, he was certainly here in spirit, and we were thrilled that Karen was able to do this for both of them.
That's fantastic, just to have a member of the community just really catch the vision and then have passion about the vision themselves and be able to contribute and participate at such a level. So we definitely appreciate the Sisel family and their contribution for sure. Just shifting back to Dr. Starbuck on the clinical side, briefly, Dr. Starbuck, if you wouldn't mind maybe just highlighting some of the features and the benefits of this incredible new facility, the new environment that our staff can work in, the doctors and the nurses, and how that translates to the care for our tiniest little precious patients and their families as well. Maybe just highlight some of the key features and benefits that this affords our patients.
Absolutely. It's hard to believe it's been a year. Every time I go up on the unit, I think this seems like it has always been here, but in my mind, I know it's taken a lot of work and a lot of evolution to get to this beautiful space. We have 51 private rooms, 2 rooms that accommodate twins. So that allows the families to be in single rooms with their child. If you think about if we were placed in another room with an adult patient, we wouldn't have a lot of tolerance. And until we were able to do this renovation and create this new environment for our families and our infants, we had as many as 8 babies in one open bay, like a regular ICU would have been in the 70s. So now the space is private. Families are able to, before COVID, of course, have more visitors. It has certainly been limited as COVID has impacted all of us in the way we conduct our own personal and professional lives.
Sure. Absolutely.
But the ability to be there and have privacy for breastfeeding and have privacy when you're the physicians and the team is rounding to ask questions. It's a quiet environment. It's nurturing. The light can be controlled just in the family space and in the patient space separately, which is just one of the things that gives people a little sense of comfort and control, that they're not just out in an open bay on a bar height stool, they are actually in a comfortable room. The parents can stay in the room, which was never an option before. So they have the ability to sleep in the room with their child if they'd like, and trade off. And that's always very important. If you've ever had a child or a close family member with a child, most people don't really want to leave a lot. So having that comfortable space is really nice. A lot of the rooms do have their own bathroom and shower, so that families can actually have their own private facility to do that. And then the twin space, often we had twins separated, and now we can have two babies in the same room, and their family doesn't feel torn between visiting one infant or the other. So those are things that we just couldn't have in the old space. And these things have just been transformative, not only for our families and our staff, but as well as the babies. We're able to control that noise level, which is just really significant in a hospital environment. And the babies really don't need that level of noise, and we're better able to control that and allow their brains to develop as they would have if they had been inside mom.
That's incredible. And, I can only imagine just with the new facility, how families have been impacted and feel like they're better able to bond with their, a lot of times newborn baby or premature baby, and to be able to have that very intimate, accommodating space, I'm sure just speaks volumes for their ability to help in the recovery process. So that's great information, Dr. Starbuck. Speaking of it being open and operating for 1 year, back to you, Lisa. The Sisel NICU, it's up and running. I've seen hundreds and hundreds of babies and patients since it's open. So I guess we would wonder if there's any still opportunities for us, community members at large, to be able to participate if they still want to support this project in any sort of way from a philanthropic standpoint.
Yeah, that's really a good point, Justin, because there are opportunities. At some level, there always will be. So certainly we wanted to do everything we could to provide ways in which members of the community could support the initiative. And really, any amount of a gift is meaningful and important and goes to a good purpose. So we were very fortunate in that we had many different kinds of spaces that we could use to recognize donors. So as an example, many of our patient rooms have a plaque outside that recognizes a donor for a gift that they made to the NICU. So there are opportunities that are still available that we can recognize donors. And I think the thing that I really want to point out and have folks understand is that while the physical space is completed, has been in use for a year, and obviously serving families very well, there are always things that are needed. So a good example of that is cameras that we use in our NICU beds, so that if the parent can't be there, say overnight or something, they have the ability to look in on their baby, see how they're doing, see what's going on. And those are the kinds of things that we continue to make use of philanthropic dollars to support.
That's great information about the new NICU. I guess I would ask the same question as a follow-up about the birth center. The birth center has been open for about a year now, and I know it serves, thousands of families at this point. Would there be any opportunities for people to still be able to support the birth center?
Well, there absolutely is. And like with the NICU, there always are opportunities, especially as we learn more through our research and other activities. We're always finding ways that we can enhance our patient care. And like the NICU, we would certainly love to have a community member's name on our birth center. And so for folks who are thinking about maybe a legacy gift, in other words, a way that they would like to be remembered in the community, certainly support of the birth center would be a wonderful way to do that. And we're always happy to talk with folks about the many different opportunities that exist to support the birth center, the NICU, and any of the other important elements of our medical center. For anybody who has an interest in supporting, they can do that even online if they're interested to make a gift, and they can go to brennernicu.org. That will take them right to a donation page.
So just to reiterate that, it's give to brennernicu.org if anyone has any additional questions or they want to look at opportunities to participate in giving and supporting these facilities. It's interesting and I applaud you, Lisa, for the work you do going out and raising funds for a project such as this before it's built. Sometimes I guess it might be hard to, you're showing people renderings and kind of trying to cast a vision virtually and through, easel boards and architectural renderings and talking about the care that's going to be provided. But to see the space, of course, we're dealing with COVID-19 now and there's visitor restrictions, but to see it in person and to see how the facility is able to care for patients, it's really awesome. And speaking of the birth center, Dr. Starbuck, going back to you real quick, we are celebrating the first birthday of the birth center. And I actually had a coworker who recently had her precious little baby daughter over at the birth center, and she had great things to say about the facility and the staff. And, I'm sure there's plenty of stories similar to that. So if you want to just take a minute and talk about, the highlights of the birth center and kind of, what's transpired over the past year over there and how we're caring for families.
Absolutely. I'm sitting here just thinking back that exactly a year ago today, we were 1 week away from the first baby being delivered in our new birth center. And it still gives me cold chills to think about that day and the number of people involved. But since that time, we've had over 2,000 babies delivered in that facility. So it has now become just what we do. We have many, many stories of wonderful outcomes, just as you've shared, where people have certainly felt the compassion and the warmth and the cared for environment that we had hoped to create as we began to onboard over 400 employees last spring in preparation for this. But I think one of the things that has most recently happened was we had a mother who was sent over from our clinic, and we have the high-risk maternal fetal medicine service here, just one of a handful in the state, and she was sent over urgently for a C-section of very premature babies. And within 70 minutes of arrival, the mother had delivered the babies, and those babies were stabilized and admitted in the NICU. So when you speak about a team of obstetricians, OB anesthesia, nurses in the L&D and procedure suite, neonatologists, NICU providers, our NICU nurses, all of those people, that is what we do today. So those mothers can rest assured that the highest quality of care for both them and their baby that we have indeed created, and that was our desire. If they arrive in labor, they get that secure private experience of coming up the private elevators, and that's a wonderful thing. They have private rooms, after they deliver, which is great as well. But if you have that emergency, we certainly have all the expertise for both obstetricians and pediatricians and specialists to take care of whatever the needs are. And with over 2,000 deliveries since we opened, we expect normally about 10 to 15% of all babies who are born will need some special care. Now, that doesn't necessarily mean that they stay a long time in the NICU, but they may need more transition time, or they may end up needing 30 days, which is our typical stay in the NICU, or they may stay for longer than that. those families, it's adjacent to the birth center, so the family doesn't have to really leave, and they can feel good about the fact that the people to care for them are in close proximity, whatever that need might be.
Yeah, that's great information, Dr. Starbuck. And last summer, when we were, excited about the birth center opening, and we had a lot of anticipation, maybe not too many of us were thinking about where we are now, a year later, and working through a worldwide pandemic with COVID-19. So, with COVID-19, pregnancies don't stop and births don't stop. So, I guess if you could just speak real quickly on how your team, the staff, the nurses, the doctors have adapted to working in the COVID-19 experience and right now that we're in, and how they still continue to care for patients, correct?
Yeah, absolutely. It's certainly been quite an emotional challenge for all of us, and physically with wearing additional equipment to provide care. But as you said, births continue. We have far exceeded the number of babies born, and that did not slow down. While some elective procedures did in this hospital and many others, we continue to have a very strong number of deliveries, which incurred a high number of NICU admissions. So both of the staff in the NICU and the birth center continued at the same pace with COVID superimposed.
Yeah.
So I think the biggest challenge for the staff is because we are very family centered, it was very difficult to limit the visitors. We did continue to have 2 parents being able to visit the infants, and a partner for the mom in labor. We never stopped that process. But as you know, it's a very exciting time for families, and a lot of grandparents, extended families, like to be at the hospital when the baby's actually born. I think we have learned how to embrace technology. And a lot of those things, such as Lisa mentioned, the NICU cameras and other technology, has helped us kind of ease that transition. But we, just like other staff, we're learning to live with COVID, and how we deliver care is slightly different, but still with the same intent and high quality.
That is to be commended, to be able to still work with pregnant moms and help ensure their safe deliveries and care for the tiny little new babies, and if they need additional care, to have that NICU there as a resource in the midst of COVID. It's really remarkable. So just in awe of our medical staff and what they do each and every day. Lisa, I'd be remiss, since I have you on this podcast, and you are the Chief Philanthropy Officer. I did want to bring up just a quick question, since we've been talking about COVID-19. I know that you all have gotten lots of inquiries and emails and phone calls about how people, can help out. There's been a lot of recognition, and rightly so, about, some of our frontline workers and healthcare heroes, and, how people can help, if it's from restaurants donating meals or companies donating PPE. If you wouldn't mind just touching on that for 1 second. It just is, we've been dealing with COVID for a little while now, and just wanted to ask you if there's still a need for that kind of support as far as COVID is related for our organization.
Yeah, thank you, Justin, for bringing that up. And I, first of all, want to thank the community for the response we've had thus far to the COVID-19 fund. It's been tremendous. And I think people have recognized that while this is a challenging time for everyone, it really is critically important that we keep our health system strong and in a position to care for the community as we see the rise and fall and everything else that's gone on with COVID. The fund is easy to reach, make a donation. You can do that at wakehealth.edu/COVID-19 support. So it's easy to do, and this is really an example of a time when any gift matters. The funds that are given here are supporting, as you said, our frontline healthcare workers, supporting our employees as they deal with the financial challenges that the pandemic has brought, but also ensuring that we have the proper equipment for all of our patients and staff, including and especially the personalized protective gear, and also supporting research. And I just wanted to bring that up for a minute because, again, it's important to recognize as an academic medical center, our responsibilities for the coronavirus don't end with caring for the patients. That's obviously the first and most immediate concern. But we need to be very much at the center of resolving this coronavirus pandemic. And we do that through our research. We have over 30 active research projects right now. That number continues to grow. Okay. And so I cannot stress the importance of funding enough.
Yeah, that's a great point about just that being such a core mission of ours. Look at how we can advance medicine and just to improve the clinical care that much more. We have I have a couple of family members and friends that are actually participating in the antibody study. So I know that the word is getting out about that study in the community as well. So hopefully, all the things that they're doing from a research perspective they're going to be able to make an impact with patient care and helping us navigate through COVID. Dr. Starbuck and Lisa, I know we're going to wrap it up here in a second. I really appreciate y'all coming on and being on the Best Health podcast today, talking about the 1-year anniversary of the NICU and the birth center. I did want to mention if anyone has any questions or wants more information about the birth center, the NICU, they can go to wakehealth.edu and search NICU or neonatal intensive care unit or the birth center. You can also go to wakehealth.edu/birth center. And there's all kinds of information on there about, there's virtual tours and information about virtual classes and lots of really good support resources there because, we all know that going through pregnancy and then having a new baby, that's life altering and a tremendous gift and blessing. But there's lots of questions for new moms and we have a lot of good resources there, so I invite people to check that out. So Dr. Starbuck and Lisa, lots of really great information, and I'm glad we're able to come on here and have a podcast about celebrating, in the midst of COVID-19, just to celebrate, the hundreds and with the birth center, the thousands of families that we've been able to care for through the first year of the birth center and the NICU. So I appreciate y'all's time and thank you guys for sharing all this great information.
Thank you, Justin. We certainly appreciate the opportunity to share and can't say enough about the community support that's helped us get there. It's been a much needed resource for our children and to be able to place the mothers and the babies now with the same wonderful resources within the academic center is really just a true gift.
It's been an amazing process to be part of, Justin. We're very proud of it, and we're very proud of the community for rallying around it. So thanks, everyone.
Yeah, indeed. Shout out to community for their tremendous support, both from a philanthropic side of things with donating, but also the volunteers that have participated, especially prior to COVID hitting and some of our volunteers that have helped and been a part of the birth center and the NICU. So to our community here, we appreciate you and ask you to keep engaged with us. And all the Best Health listeners out there, thank you for listening to the special podcast. And I want to invite you all to come back and listen to us next time. But until that time, I encourage everyone to please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.